Hi, my name is Alexie Ferreira. I'm a third-year medical student at the University of Ottawa. I am doing this research project with Dr. Saginer, pediatrician, Dr. Gravel, and Dr. Palerme, obstetricians at the Montfort Hospital. The title of our research project is COVID-19 in a university-affiliated obstetrical unit, maternal and fetal morbidity in a pandemic. Here's an overview of my presentation: background, objectives, method, and conclusion. Background information. The COVID-19 pandemic was declared on March 11, 2020 by the World Health Organization. This virus is primarily spread by respiratory droplets and direct contact with infected body fluids. There are numerous clinical manifestations such as fever, fatigue, or pneumonia. However, many COVID-19 carriers may be asymptomatic. Women entering the Montfort Hospital Family Birthing Center are categorized in 5 levels of COVID risk categories, according to the absence or presence of symptoms and based on the swab result and exposure to COVID-19. The research question is: does the COVID-19 environment ante and intrapartum have an impact on maternal and fetal morbidity compared to prior to the pandemic? The goals and objectives of our research projects are to compare rates of maternal and fetal morbidity among COVID-19 risk levels, compare rates of maternal and fetal morbidity during the COVID-19 pandemic to a similar time frame prior to the pandemic, determine breastfeeding rates at discharge from hospital amongst COVID-19 categories and compare to prior to the pandemic. A retrospective cohort design will be used in this study. An electronic chart review will be performed to obtain patient information. Data from April to September 2019 will be compared to the pandemic period from April to September 2020. Analysis will be conducted in order to compare parameters between the 5 risk categories for COVID-19. Criteria for inclusion will be women delivering a single pregnancy above 34 weeks at the Montfort Hospital. Excluded will be women less than 18 years of age. Maternal parameters will include symptoms of COVID-19, preeclampsia, mode of delivery, postpartum hemorrhage or transfusion, fever in labor, transfer to ICU, length of hospital stay. Fetal parameters will include gestational age, birth weight, ABGAR, NICU admission, need for respiratory support, umbilical pH, and rates of inter-hospital transfer. Second parameters, breastfeeding rates at discharge. Determining if the mother and baby have a greater morbidity during the pandemic would open the discussion on how to improve such rates. Having to wear a mask at all times may limit a woman's ability to have a spontaneous vaginal delivery with corresponding increases in C-sections. Although mental health is not addressed specifically in this study, the impact of isolation and virtual care on women, as well as limited support to people in labor, may have an impact on the overall outcome of delivery. In urgent situations, the potential delay to management may also have an impact. Improvement in quality of care given to our women and their babies is our ultimate goal. In conclusion, obstetrics is a field particularly affected by the COVID-19 pandemic. Pregnant women require ante and intrapartum care despite reduced access to health care. Better understanding the impacts of the pandemic on our population will help refine risk categories and ways to improve their experience. Thank you.